Good morning. Hello and welcome everyone to Patio Conversations with Ayeisha McNeil, author, speaker, financial consultant, and your mental illness advocate today. Today our topic is anxiety and depression. So let us continue. No matter what we face, we will forever take life by the throat and make it speak into existence what we desire. So, moving on. Let's look at what anxiety is according to the definition. So, if you are here, please don't be shy to say hello. We are going to talk about anxiety and depression as I told you last week. So today, anxiety, let's look at the definition. Anxiety is your body's natural response to stress, okay? So anxiety, to some level, is natural. It is your response to stress, your body's response to stress. It's a feeling of fear or apprehension, okay, about what's to come. The first day of school, a job interview, or giving a public speech may cause people to be a little fearful or nervous, okay? Fear or apprehension, right? Now, they've come up with 6 different major types of anxiety, okay, disorders. Anxiety becomes a concern when it's actually excessive and uncontrollable. What does that mean? Is anxiety normal? Yes, anxiety is normal. But the basic anxiety is something that you can pull yourself from. The uncontrollable anxiety we will discuss, different behaviors will happen when you are in certain social settings or about to do something, new to you, or maybe something, something that you continue to do, but you just get these certain behaviors start to happen when you go to these places or before certain people, or maybe come up against certain things, okay? So let's go ahead. I'm going to talk to you about 6 major types of, well, actually, I'm just going to list the 6 major anxiety disorders, but we're going to talk about the basic behaviors of anxiety, okay? So, separation anxiety disorder is number 1. Number 2 is a specific phobia. Anxiety, when you're afraid of something, maybe it's spiders that sets you off or something like that. That is a specific phobia that you have that gives you these anxiety behaviors that you go through. Then there's social anxiety, depending on people you're around or certain people you're around, or even just people in general. So that is called social anxiety disorder. There's panic disorder. You find yourself in a situation, you just panic, or maybe there is no situation and you, for some reason, panicking. So that's panic disorder. Agoraphobia, that's another disorder. Generalized anxiety disorder, anxiety in general, okay? So let's talk about the basic behaviors of anxiety. One of the basic behaviors of anxiety is excessive fear and worry about various life situations or circumstances that have no factual or logical basis to support that worry or that fear, okay? You're afraid, you don't know why you're afraid, but you're afraid. You're just afraid. You think something's going to go wrong all the time. You just see something going wrong all the time. And even though you don't have any facts or any logic to back it up, you just have that excessive fear or worry about that. 2, constant worry about your family, a job, your social interactions, or your health. That's another anxiety way of getting the worried, over worried, extremely worried about those things. You tend to blame yourself for the slightest imperfection or mistake. So a simple mistake that somebody naturally makes, you tend to go excessive to like 1,000, and really blame yourself and beat yourself up badly because of that little tiny mistake that anybody could have made, okay? Then there's the lack, you lack the ability to concentrate due to the fear and the worry that you're experiencing. You may even have sleep problems. And having sleep problems, of course, leads to irritability, right? You're going to be irritable a lot throughout the day if you don't sleep well. So it's going to be extreme for you because you got worry, you got anxiety, but now you got, is mixed with these sleep problems and being irritable. Okay? Now you also have a fear of saying or doing something in social settings due to your lack of confidence. You have a huge self-esteem issue. Okay? Huge. Like, it's not something like us women, sometimes we basically like, oh my God, I got a pimple, or oh, I look, this or this something, and we get over it because we could fix it. But you have an extreme self-esteem issue, whereas nothing can calm you down about the fact that it's really not that serious, but for you it is that serious. Okay? So those are some of the basic, and now we move into a few more. It's autonomic hyperactivity, such as cardiac palpitations, shortness of breath, sweaty palms, dry mouth, trouble swallowing, nausea, and diarrhea. Restlessness, tiredness, muscle tension, maybe even shakiness. Okay, and we're talking about anxiety disorder. So then there's the possible abuse of substances because you are trying to self-medicate. So now because you can't get your anxiety under control, you'd probably, I don't know, maybe it's marijuana, maybe it's some kind of pills or whatever it might be. You're trying to utilize these substances so you can cope with your anxiety, realizing that that's really doing more harm to you because you need to get to the root, to the cause of the issue. So you have to look back and say, why do I have this anxiety? What is causing this? Why am I feeling this way? Why do I get this way when I'm here? So we're going to talk about some ways that you can look into going back and trying to determine why your anxiety is where it is, or why you having these behaviors. Okay? Because for everything there is a cause. Okay? There is a root cause for it. The solution is always to get to the root cause of something so we can fix it, right? So what does it feel like to have an attack when you are experiencing anxiety? Well, it's stated that possibly you may feel like you're losing control of yourself or going crazy. Your heart palpitations or chest pain may be present. You may feel like you're going to pass out and possibly have trouble breathing or feel like you're choking. Okay? Like any illness, stressors are present. The goal is to find the stressor and create a routine to manage your feelings, to avoid the stress that triggers your episodes. That is the goal, right? So if you need therapy or medicine, you should talk to your doctor and communicate what you're going through. Okay? If you feel your symptoms are out of control and you have no control or no sense or knowledge of what's going on or where it's coming from, be able to describe what you are feeling. Because if you're able to describe what you're going through and what you're feeling, then you are going to be able to be helped. Okay? So now medicine may not always be the answer for you. I mean, we're living in a society where they think they could throw medicine or some kind of substance to you and that it'll fix it. No, sometimes talking and having a purposeful routine, it can assist you in managing your stress triggers, okay? Because we all have stress triggers. So what I'm going to go into is giving you some coping strategies, and where you can find these coping strategies for anxiety is on www.adaa.org, okay? So this is where you can go and get some information on anxiety disorders, okay? www.adaa.org. And you'll find some coping strategies for anxiety. They'll also tell you about depression as well. So, 1, take a time out. What does that mean? That means practice yoga, listen to music, meditate, get a massage, or learn relaxation techniques that works best for you. Because if somebody else is trying to be relaxed, it doesn't mean that that relaxation technique is going to work for you. You have to find what's going to work for you to deal with your anxiety. Okay? So stepping back from the problem helps you clear your head. So sometimes if you can't solve it, you get so You get so fearful, so worried about it, and you're gonna make mistakes. So the best thing to do is to step back from the problem, and clear your head about it. Okay. Another thing you can do, like any disorder or even without a disorder, is eat well balanced meals. What does that mean? Do not skip any meals. Breakfast, lunch, and dinner, and your healthy snacks. Do not skip any meals, because good food feeds your brain, and it allows your brain to function well. Okay? So you need energy boosting snacks on hand. So a piece of cake is not going to help you. Chips are not going to help you, although we want to grab a piece of cake and chips and cookies, right? But the healthy snacks that's going to boost you is something like almonds. It's something like, an energy drink, a protein drink, or something like that. Something that you can snack on that fits you and that you're not allergic to, of course. So, and another thing we can all do, whether we have anxiety or depression, is to exercise daily. What you will notice is a lot going on in your brain when you're exercising, because your body is really speaking to each other, right? So it helps you to feel good and maintain your health. So there's going to be some fitness tips that I can help you with as well. Now, the next one is take deep breaths. Inhale and exhale slowly. Like, some people try to inhale and exhale, they're like, no, you can't do it like that. That's stressful. So you want to take slow inhale and exhale breaths, okay? That's going to help you. And what that's going to do is going to kind of like reset your mind and allow you to reorganize and rethink a little bit, because you're going too fast in your brain, okay? And you can't really comprehend or slow down a little bit. So yes, take deep breaths, inhale and exhale slowly. Now you can count to 10 or you can count to 20 slowly. And you can repeat it as necessary until you are able to calm down when you step back from the situation, okay? Now, the best thing you can do is do your best, okay? Instead of aiming for imperfection, which is impossible for anybody, be proud of what you accomplished, that step by step. Be proud from one moment to the next moment, because you know your situation and you know how challenging it is for you with anxiety. So if you get closer to doing something or completing something, celebrate that moment, okay? Don't be mad at yourself because you didn't complete it when you wanted to. Don't be upset or worried or afraid, because eventually you will finish, okay? You're a person who starts something, and I'm sure you're never going to give up, okay? So, another thing. I love this one. Accept that you cannot control everything. Now, whether you're experiencing anxiety or depression or not, this is something for us as a human being. We have to understand that we cannot control everything. In fact, we are in a world that controls what it does, and we're just living in it. We're only able to control how we respond to something, right? Which means we can't control everything. So make the best at doing your best, even if it's a little, because if you ever read the book The Tortoise and the Hare, you will find that the turtle may have moved slow, but the hare thought, I got all this time and I could play around. He's not going to pass me. And he slept on the job. And the turtle was moving very, 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 very slow. But eventually the turtle won, right? So it doesn't matter how slow you do something. Just get it done. Okay? And if you need help, don't be afraid to ask for help. There's always someone. There's always a diamond in the rough waiting to help you. Okay? And another thing, welcome humor. Yes, laugh. Welcome humor. Now I'm gonna tell you a joke, but it might not be so funny. But I was eating an icy, right? And on the icy, it says, what driver never gets a parking ticket? And I said, what is that? So I looked and I saw the answer, and it's a screwdriver. A screwdriver never gets a parking ticket. Listen, don't shoot me, okay? It wasn't my joke. I just thought it was funny a little bit, So, but anyway, you get the point. Welcome humor in your life, okay? Don't be so serious, okay? So, another thing, this is big for anybody, whether anxiety or depression or whatever mental illness, is like you have to try your best to maintain a positive attitude. Make an effort to replace negative thoughts with positive ones. So that negative thought is coming, negative, positive. Negative's coming, you like, positive, positive, positive. Combat it. Beat it up. Bring them positive thoughts. You got them, even if it's something that you want to do and dream of. Now, another thing you can do if you have anxiety and you worried, get connected with people. There's groups. You can volunteer too. You can volunteer and find another way to be active in your community, which creates support network. And it gives you a break from your everyday stress. So when you have to do something that stresses you out every day, sometimes taking a break in what you normally do, it helps. It helps some people, okay? So it's volunteering, getting connected to people you don't know, just to, help the community, someone in your community, have at it. Take a chance. And this is a big one. And I would tell you, keep a journal next to you. Really like walk with it if you have to, but learn what triggers your anxiety. Okay? Is it work? Is it family? Or something else? Identify it, because that is the root that you would have to learn so you can be successful at dealing with your anxiety and making life happen positively for you, okay? Talk to someone. Tell friends or family, those that you trust and you feel comfortable around, if you're feeling overwhelmed. And let them know how they can help you. If you know a way that they can help you, let them know. Talk to a physician or a therapist for professional help, okay? Now, I'm going to give you quickly a few fitness tips because I want to move on to depression, because we talked about anxiety and what you deal with. So let's talk about the healthy healthy tips that you can manage your stress with, okay? You can jog, walk, bike, dance 3 to 5 times a week for 30 minutes. Me, I like to walk. I don't bike. Jogging is cool, but I ain't big on that. The knees, depending on how, if you was active in high school like me, what I did. The gymnastics, I was on the bars. I played basketball with, volleyball and flipping and all kinds of things. So, running track and stuff like that. So you might not want to really jog or run, but walking and biking or dancing is always fun. Dancing, move them hips and just start dancing. You feel excited. The music moves you. You get excited about it. So it's a workout. Okay? Set small daily goals and aim for daily consistency rather than perfect workouts. So what does that mean? So don't try to be perfect in the workout. Don't try to be, 50 minutes, 40 minutes. Try to do something like, maybe if you do 15 minutes, even if it's 10, if you can start with 10 minutes, do 10 minutes today, 10 minutes tomorrow, 10 minutes the next day. Be consistent. It doesn't matter how much you do, but the more consistent you get, and I know this. I used to go to my personal trainer 3 times a week. When I wasn't with after I got acclimated into my personal trainer, and he made me do certain things, I was doing it at home for the rest of the week. So basically, I was still going out doing 90 minutes of workout, which was running, listening to music, dancing, and all those other things when I wasn't with my personal trainer. So if I went to my personal trainer on Monday, I was doing my own exercise on Tuesday. I went to him on Wednesday, I was doing my own exercise on Thursday. Okay, so be consistent, however that consistency works for you. Okay? Now, do something that makes you happy to distract yourself. Maybe podcasts, musics, or audible books, you may find that relaxing for you, taking you away, from your anxiety and the behaviors that the panic attacks and things like that. Okay? And be patient with yourself. Be patient with yourself. Okay? When you start a new exercise program, most sedentary, people require about 4 to 8 weeks to feel coordinated and sufficiently in shape, so that feels easier. You will always end up wanting to increase that anyway. And recruit a buddy, recruit an exercise buddy, so they will hold you accountable, so you have fun, you have somebody to talk to, you can have, make jokes with each other while you're doing it. So we talked about anxiety, and real quick, I'm going to go ahead and tell you again. So anxiety is excessive fear and worry about various life situations and circumstances, constant worry about family and job, social interactions or your health. You tend to blame yourself for slightest imperfection or mistake. Feeling constantly on edge, lacks the ability to concentrate due to the fear or worry that you are experiencing. Sleep problems, irritable, fear of saying and doing something in social settings due to the lack of self-confidence. Cardiac palpitations, shortness of breath, sweaty palms, dry mouth, trouble swallowing, nausea, diarrhea. Restlessness, tiredness, muscle tension, maybe shakiness as well. So all of these things together. Okay, don't think, because you got one that you have this. Don't think because you got 2 or 3 because you have that. What the doctors go off of the DSM-5 book, right? And it's like if you have 5 or more symptoms, and this is when you're not taking drugs, when you in your natural state, not taking drugs and not taking medications, and you find yourself going through all of this, then you might want to talk to somebody if you can't control your anxiety, your worry, and your fear. Okay, like I said, medicine is not for everything and everybody. You can find ways to cope with your anxiety, but there are some to the extreme that may require medicine, but I'm not a doctor. You will reach out to your doctor and let them know how you feel. So that is anxiety. We're going to go ahead and move to depression, okay? Now, with depression, these are some behavioral things that happen, okay? You might feel, and this is all talking about the extreme mental emotions, not your regular depression for a few moments or for a day or two, but this is talking about extreme mental emotions. When you feeling these things, it's really extreme. It's past just normal, okay? So you feel very sad or down most days of the week. You feel like you're in a vegetative state, practically. You have sleep disturbance, appetite disturbance, fatigue, weight change so quick within the week or so. It's fluctuating. Something is causing you to either overeat or undereat, decrease and increase in appetite. You have these persistent feelings of helplessness, hopelessness, worthlessness, or guilt. Loss of energy, excessive fatigue, okay? Not your normal fatigue, but your excessive fatigue. Poor concentration, indecisiveness. And mind you, we're talking about depression now here. Low self-esteem, mood congruent hallucinations or delusions, okay? And you're starting to engage in substance abuse as a means to escape your feelings of sadness, worthlessness, and helplessness or guilt, okay? You may tend to have in depression suicidal thoughts. You may express a wish to die without a suicidal plan. You may think it out, you may plan it out, or you may just feel like it, but you don't have a plan. That's depression behaviors, right? What you can do, this is the criteria for major episode according to the NAMI, family to family, and they source came from the DSM-5 American Psychiatric Association. So 5 or more of the following symptoms have been present during the same 2-week period. So if it's 5 weeks or if it's 5 or more symptoms during the same 2-week period and represent a change from previous function, which means that it's totally different from how you used to be, at least one of the symptoms is either depressed mood or loss of interest or pleasure. So if one of your symptoms say, okay, I'm depressed, or I'm losing interest or pleasure in the things that I used to, and not only am I losing it, it's like to the extreme, like I can't get back like normally I could get back, but this is how I'm feeling in a 2-week period. So these are things you might, not, like I said earlier, with anxiety, do not include symptoms that are clearly due to general medication condition or mood congruent. Let's just say that if you're taking medicine and you know that it has side effects, don't include that in your depression, because you may be just experiencing side effects from some kind of medicine that you're taking, okay? So let's look at this. You're going to be depressed. You're going to have a depressed mood most of the day, nearly every day. Either you know it, or either someone is observing you of this behavior. Now, markedly diminished interest or pleasure in all or almost all activities. Most of the day, nearly every day, you're going to lose interest or pleasure in almost everything that you want to do. That is depressed. So when you lose interest or pleasure in everything or almost everything, you may be going through an episode of depression. But listen, like I said, you need at least 5 or more of these conditions. So one was the depressed mood, mostly every day, all day, okay? The second one, like I said, interest and pleasure in almost all things every day. Significant weight loss when dieting or weight gain, okay? A change of more than 5% of body weight in a month. So if it's been a month and you have more than 5% of your body weight, you haven't been exercising, but you either gained weight or lost weight, okay, more than 5% in 30 days, you might want to look at that. Now, that's either by what you observe or what somebody else around you, other people observing, and maybe voice their opinion to you about it. You may have insomnia or hypersomnia nearly every day. Like I said, we are talking about depression, major depressive episode, okay? Now, psychomotor or hypersomnia nearly every day. Every day, okay? Fatigue or loss of energy nearly every day, okay? Feelings of worthlessness or excessive or inappropriate guilt, which may be delusional. That's what you think in your mind, but you feeling that nearly every day, okay? Diminished ability to think or concentrate, or indecisiveness nearly every day. Recurrent thoughts of death, not just fear of dying, recurrent suicidal ideals without a specific plan or a suicide attempt or a specific plan for committing suicide. You may be experiencing a major depressive episode, okay? The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of your functioning. The symptoms are not due to the direct physiological effects of substance or general medication, like I said earlier. But this is something that you are feeling every day, okay? A major depressive episode, once again, when you're feeling these things every single day, you have to observe that. You have to be able to communicate that the way you feel if you're feeling depressed. Okay, we don't talk about this, but we must be able to communicate it. And if it's somebody you trust, communicate it to them. Find a therapist. They have online therapists. You know, there's questions that you want to ask your therapist to make sure that that is the right therapist you're talking to. And just because you're talking to a therapist doesn't mean there is, you know, you're a bad person. It doesn't mean that you're evil. It means that you're seeking help. It means that you want help. And at the end of the day, the result is you're going to be a better person. You're going to feel better. You're going to see things clearly. You're going to see things better than you used to. Okay? So what I want to also go into now with not just depression, but I want to talk about the women in depression. Men, I know you deal with depression too, but women deal with depression more than men. But men, if you are dealing with depression, please understand. Please seek help as well, because you may be experiencing some of the things that women are experiencing. But the reason why women experience it is because their body goes through extreme changes. Women who haven't had children, they still go through the process as if they are going to possibly have children. Women who go through childbirth deal with depression. Women who have the postpartum depression can last, you know, it can last shortly, or it can be something long term, because you are dealing with hormones, emotions, and the mental, the physical. It is powerful. The mind is powerful, and you need a support group. You need a support team. You need a support person. I'm an advocate for having support. You know, I love supporting people when they need help, or when sometimes you don't know they need help. But a smile helps, you know, a gentle, kind word helps, you know, being there for someone in some kind of way, a small way, can help them, you know. But let's talk about this real quick. Clinical depression, because you guys know that I just try to, okay, it's 11:34, just a few more minutes we're going to be here, 45, right? So, what causes the higher rate of depression in men? In women. The explanation for the gender gap in susceptibility to depression most probably lies in a combination of biological, genetic, psychological, and social factors. Now, the biological factors there appear to be important links between mood changes and reproductive health events, as I was mentioning earlier. Gender differences in rates of depression emerge when females enter puberty and remain high throughout the childbearing years and into late middle age. Hormonal factors, as I said earlier, seem to play a role in some of the mood disturbance experienced by women. 20 to 40% of menstruating women experience premenstrual mood and behavioral changes. Approximately 2 to 10% of women experience premenstrual severe disorder. A form, it's called dysphoric. So premenstrual dysphoric disorder. Now, that's a severe form of premenstrual syndrome that is categorized by several impairing behavior and mood changes. So men, you have to understand that women, when you say that women are emotional, all humans are emotional, but women go through, it's not that they're emotional, they experience a lot of depressive and body changes because of childbearing and hormonal changes, because they bear children, or they have the possibility to bear children, and that's not present in men. Okay? So there also appears to be an increase in depression during perimenopausal period, but after menopause, this does not appear to be the case. Differences in thyroid function, between men and women may also contribute to the gender difference in the prevalence of mood disorders. Another biological factor that may contribute to gender differences in depression can be linked to circadian rhythm patterns, the complex system that regulates sleep and activity over the 24-hour period. Okay? So, once again, that is the circadian rhythm patterns, which takes place when it's trying to regulate your sleep and activity within the 24-hour period. Okay? Depressed women report more hypersomnia, which is excessive sleeping, than do men. Gender differences in the activity of neurotransmitters, including serotonin and the effects of estrogen on these neurotransmitters, may also be linked to gender disparity and rates of depression. So yes, women are experiencing more depression than men are. However, the truth is men are experiencing depression too, and it needs to be recognized and looked at. Okay, so genetic factors, is more like it could be hereditary. It comes from a family. So some family members, a family that has no depression is less likely to end up someone getting depression. But a family that has depression is more likely to, of course, someone in their family will get depression, like mother, father, siblings. Okay, so let's see. There are psychosocial factors, and that may contribute to women as well. Increased vulnerability to depression include the stress of multiple work and family responsibilities, sexual and physical abuse, sexual discrimination, lack of social support, traumatic life experience, and yes, poverty. Of course, poverty will lead to depression for anyone. Okay, so we talked about depression, we talked about anxiety, we talked about depression, we talked about the behaviors of anxiety, we talked about the behaviors of depression. Now, like I said, according to the DSM-5 book that the doctors use to diagnose mental health issues, they look at 5 or more, and if you are experiencing these things, they also look at what you're telling them of what you're going through and how you feel. So be honest with your doctor. Be honest with your doctor. I remember I used to go to a dentist in Brooklyn, New York, and it was Dr. Patel, and he had this wooden piece of board or whatever you call it, and it said, "Be true to your teeth or they'll be false to you." So I believe that tell the truth to your doctor so they don't make false diagnoses. Okay, so they don't misdiagnose you with things. And if you are taking medication for something, tell them what medications you're taking, because they know the effects. And when you mix something with something else, then it can cause an extreme effect of something else. So be honest with your doctor. So like I said, every time I do these, I'm going to quickly give you the resources. Okay, so the resources for anxiety and depression, you can go to, like I said, www. What I called it. It is www.adaa.org, okay, for anxiety and depression. You can look at that. The resources for anxiety and depression or any mental illness, of course, is going to be your National Alliance Mental Illness, which is www.namiga.org. And their helpline, NAMI helpline, is 800-728-1052. Now, real quick, when you are calling the police, the 911, for someone who has a mental illness, I need you to say this. When you are on the phone with that dispatcher, I need a CIT. I need Crisis Intervention Trained Officer. I need a Crisis Intervention Trained Officer. CIT. This is your best friend on the 911 when you're dealing with mental illness. I need a CIT team. I need a Crisis Intervention Trained Officer. Do not just call them and tell them you have somebody's going this and they going crazy. Send a Crisis Intervention Trained Officer. There are officers out there that is trained, but too many of you guys are calling 911 and calling the police to the situation. I understand it is a heated situation. However, CIT, request CIT, and here's a crisis team number that you can call 800. So therefore, if you have time to, you can probably get your local crisis team number. But here's the number: 800-715-4225. Now the website is www.mygcal.com. That is for the crisis team. So 800-715-4225. Call the 800 number and see who your local crisis team is, and try to meet the officers who are trained for mental health people who are experiencing episodes that you need to call 911 for, okay? Now, as always, I will tell you, always speak positive over your life, okay? I want you to say, I am living positively on purpose. I'm amazing at what I do and what I can be. I love me some me because I take very good care of my mind, body, and soul. I am capable of conquering everything and anything in my life now. I am the greatest me ever born in this world as a gift. I am successful. I am love. I am me. Yes. Okay? Well, thank you for tuning in to Patio Conversations with Ayeisha McNeil. I hope this forum helps you and your loved one to take life by the throat and make it speak into existence what you desire. To be healthy, think healthy, and love healthy. Let's live on our own terms. Have a wonderful day. I love you. God bless.